Hello, and welcome to the Osteogenesis Imperfecta Foundation's podcast series. My name is Danielle Simber, and I am the Communications Manager at the OI Foundation. On each podcast episode, the OI Foundation brings you information about the diagnosis and treatment of osteogenesis imperfecta presented by an expert in the field of OI and rare bone disease. The podcasts are part of the ongoing educational effort of the Brittle Bone Disorders Consortium, part of the National Institutes of Health Rare Disease Clinical Research Network. Our podcast today will focus on disability identity and OI. We're very excited to have with us today OIF Board member Dr. Kara Ayers. Dr. Ayers is Associate Director of the University of Cincinnati University Centers for Excellence in Developmental Disabilities. Welcome, and thank you so much for being here with us today, Dr. Ayers.
Thank you for having me, Danielle. I'm very excited about this topic because I think it's one that our OI community will find interesting and one that we can definitely talk about today.
Great, so we'll dive right into the first question. What is disability identity and how does it relate to OI?
Okay, disability identity is the way that we think and feel about disability in relation to others and our world overall. So it's very different than how we typically define disability or how we typically would define OI, which might be with a list of symptoms or the medical ways that OI impacts us. Disability identity is more about our own thoughts and feelings about it, and it's definitely something that changes over time. So as a researcher, I come from a background in psychology. I'm a psychologist, and I'm also a person with OI. I have type 5 OI, and I use a wheelchair for mobility. And I know that from my own personal experience, my disability identity has definitely changed over the years. And so as a researcher, I became interested in those changes in identity and also what disability identity means within our OI community. And that includes the wider scale of our OI community. So both people with OI and then also parents of people with OI who do not have OI themselves. So that's what some of my research has looked into. I think it's really important as a researcher to find ways to explore disability identity with the idea that there's not necessarily a right identity, so there's no preferred disability identity when we're looking into this. There's lots of different ways that we think about our parts of our life that are impacted by OI. But research does show that there are some parts of identity or identity outcomes that do seem to result in more positive outcomes. Things like employment. We're able to see aspects of disability identity among adults with disabilities who have achieved outcomes that I think most of us hope that our children will achieve in terms of finding fulfillment in their life, finding employment, being satisfied in their relationships as an adult. So while there's no kind of right disability identity, there are some things that we know research tells us are linked to more positive outcomes. And so for that reason, we kind of look deeper into what parts of identity might be more linked to successful outcomes. And some of those pieces are found by measures of identity, and that's what I've used in my research. And so the first one is pride, which isn't so much in the definition of the word pride. It also has to do with how connected we feel to our disability community. And I think our OI community is unique in that we have some pretty tight networks, both within individuals with OI and then also within the parent community, including parents who do not have OI. So in my research, I've actually found quite high measures of pride within parents without OI. And my thought is that may be because many of the people who participate in our study are very connected to other parents experiencing parenthood of a child with OI. The other pieces of disability identity relate to how we view OI, in that when we look at the challenges that we face with OI, do we look at them exclusively from a medical perspective in terms of things like pain or fractures or things that we would think of to be treated at the doctor, or do we also look at the social sides of OI, things that might be stereotypes that people have before they get to know us? Many adults with OI have faced discrimination related to employment or difficulty forming relationships. So those are all kind of social aspects of living with OI. And we found that if people, as they develop their disability identity, recognize that while it's much more complicated to think of OI as these different pieces, it also allows us to have a little bit more realistic of the whole picture of OI and how it impacts us, because it doesn't only impact us in a medical way. And then lastly, the piece of what some people term disability culture related to disability identity. And there's many pieces of that, just as there would be within any culture, but some pieces that I'll point out are humor, in that many people within the OI community are able to have some kind of inside jokes, and I think that's what people really enjoy when they get a chance to come to a conference or a support group meeting, because you get to connect to people that kind of get things that maybe nobody else in your life gets, even though this is the first time that you've met them. And another piece of disability culture is interdependence. So the recognition that, sole independence, meaning that you are going to exclusively do something all completely by yourself, may not be the ultimate goal, in that it may be best to set up a system of support so that you can reach a goal that you have, which might be living in the community or living in an apartment. It doesn't necessarily mean that you need to live completely alone with absolutely no help. It may mean that you have some supports from family or friends or professional caregivers throughout the day or the night as needed, but still your goal of living in the community is what's most important. So that is, as you can see, disability identity is complicated, but I think once people start to think about it, they realize that it's a larger piece of who they are than they may have realized.
Great, thank you.
Mm-hmm.
How can parents build disability identity in children and teens with OI?
I think of this in a few different ways. I think the very first thing is to talk about this a lot and to recognize that it's not going to be conversations if you don't have OI yourself or you don't have another disability. It may be difficult to know how to start these questions or these kind of questions that would hopefully launch a conversation, but that's okay. To go into it with an open mind and ask your child, no matter what age they may be, so make your questions developmentally appropriate, of course, meaning based on their age, but being open to seeing where these conversations go, and also keeping in mind that there's no right identity and that their identity is most likely going to change as they mature and as they experience different things. The next strategy I would suggest would be to connect. Unfortunately, parents of children and teens with OI are faced with a challenge because the media and our society at large really doesn't provide us many positive representations of people with disabilities in general, much less people with OI. We can't just kind of open our browser and see in the normal kind of kid-teen places. We have to kind of look for these positive representations of disability. And so it's really up to parents to connect kids and teens with other people with OI and with other disabilities as well. I think also has value, because they realize that kind of helps us bridge from the medical piece that there are shared things across the disability community that may be wider than diagnosis. So I like to encourage parents to connect kids to both same age or similar age peers, but also look kind of their next step. So if we're talking about a 14, 15-year-old, look to maybe college age kids. So you also want to connect to mentors, and those can be difficult bridges to make, but if you're able to make both the connections with peers and also mentors, that's going to really help you in giving your kids support to build disability identity. Also, just recognizing that you're going to be growing together. You as a parent, whether you have OI or not, also have a piece in this identity formation, and so that will likely change over time as well. And there can be some conflict in building identity. There will be times of challenge and times where you question what you thought before about something, and all of that is okay. And all of those things are important things to talk about. I encourage people to really be cautious around ways that you promote any kind of piece of OI that what I call kind of removes power from the person or the child with OI. So it can be really difficult when you're experiencing a very painful part of OI after a fracture that not only is physically painful, but may have disrupted life, may have disappointed something you had hoped for, disrupted plans. So it can be really easy to feel like hating OI, and that can be a very deep and honest feeling. It's really sometimes helpful to help the child or the teen break that down into what pieces of it do they hate, because if we're building an identity that as a piece is connected to OI, it can be very difficult to kind of not ball that into an overarching identity. And so it can be helpful to really talk about what parts of OI at that time they hate. Do they hate, which is it? Do they hate the physical pain? Are they also struggling with the disappointment and what this means? And so that kind of circles us back to the conversations that I encourage. And those conversations often happen at some difficult times for all of us as family members. Just a couple of other tips of what parents can do to build disability identity. Promoting self-advocacy is very important, from having your child take part in IEP meetings if they have them at school. Other times that the child has a chance to speak up is really important. I love it when kids and teens have the opportunity to take some power back in their medical treatments. And there's a lot more knowledge, I think, around current treatments in terms of, I'm able to hear pretty young kids be able to describe those in terms that they understand, in terms of bisphosphonate and what that means to them. I like it when I hear them feel empowered in being able to describe what their treatments are like and what role they have in that. And I always remind parents, too, how excellent it is to empower them in the parts that they're taking to make themselves stronger. So it's not only the bone juice, it's also them exercising and then making good choices. And so, of course, we don't link it in a way that makes them feel like that if they were to fracture, it was because they didn't do any of that. But I always like to encourage it to be have them be able to take some stake in their health, because whether we have OI or not, we can all play an active role in trying to stay healthy and make healthy choices. And I think the last tip on this would just be to encourage your family to learn from social justice and civil rights movements as you move through. Often childhood and adolescent years with OI are very OI specific in terms of medical treatment. I think ideally the goal in pediatric treatment is to get to a point where you stabilize and you can enjoy some adult life without such medical involvement. So I think that once you look into the civil rights movements, you'll see more parallels than you might expect, and that kind of prepares you for that next step into developing disability identity.
That's great information. Thank you. Can you tell us a little bit about your recent research related to disability identity and OI?
Yes. So my research this year has involved the work of two different teams of interdisciplinary graduate students. And my favorite part about this, and it's both as a professional, but I think sometimes maybe it's also selfishly, as I'm still a patient with OI when I need medical treatment, and I'm also frustrated sometimes by the lack of knowledge in the general medical community. So I love the fact that my graduate team is made up of occupational therapy students, physical therapy students. I have a child life team member on my team and a genetic counseling student. And so I love the idea that they're getting a more intense look at OI, and they'll take that into their generalist work as medical professionals. And so, and our entire program does that. We graduate a cohort of 26 students from the LIND program. It's leadership in education around neurodevelopmental and other disabilities, is LIND. And so I work with a team of interdisciplinary students, and this year we conducted two separate projects. And so the first one looked at disability identity among parents. And so those parents included parents with OI, and then also parents who don't have OI but have a child with OI. And so what we looked at were attitudes around prenatal testing. And we know that thoughts around parenthood and OI, especially pregnancy and OI, are very complicated and difficult to untangle. So one way that we wanted to start was working with the genetic counseling field and figuring out how we could better equip genetic counselors to have these conversations with people impacted with OI, whether it be they have OI themselves or they already have a child with OI and they may be interested in having another child, and so they want to have a consultation to see about their family planning decisions. So we dove into this kind of not knowing what to expect, and we got some really interesting surprises. We found that within the sample that we studied, we found that parents without OI actually demonstrated greater disability pride within the measure that we used compared to the parents with OI. And again, disability pride isn't defined in necessarily the proud sense. It's defined as the connection to the community. So in this case, they felt that they really cited that their connection to other parents in the OI community was an important facet of their experience related to OI. So we also found some differences between beliefs around wanting prenatal testing. So parents without OI had a much stronger interest in wanting that prenatal testing. And when we dug a little bit deeper in terms of some of the comments around that, we found that some parents with OI were concerned that they may be directed towards a route of terminating if their child did indeed have OI. And so I think that gives us an opportunity to apply this research in terms of both educating the OI community that ideally the field of genetic counseling should be objective about disability and should give you a wide range of choices. But it is a definite valid concern in that, professionals should be unbiased and objective, but many of us, including myself, when I'm a biological parent to two, and I'm an adoptive parent to one child. So I've experienced genetic counseling twice. I've had positive experiences, but you can often read into people's thoughts around decisions around deciding to pursue pregnancy when you have a genetic disability like OI. So I think it's very difficult and very complicated, and I think we need more studies like this to have these conversations around what goes behind these decisions, both on the professional side and because the genetic counselors want to know how to better serve their clients, and then also on the OI community side. So we just wrapped that up about a month ago, and we are rolling out the results, and we'll be sharing those very soon in a few different ways. And then the second project that I focused on is related to ongoing work that I do with the Disabled Parenting Project. And this focused on a literature review where we created two in-depth fact sheets for one. So one is for obstetricians that would be treating parents with disabilities, including parents with OI. It would give them kind of some basics to work with those patients. And so this was in response to some consulting work that I've done with some mothers with OI who have really had some difficulty finding prenatal care when they're pregnant. I know I've worked with a mom in Idaho that drove 3 hours each way to find a doctor that would take her case, and she was pregnant, so that's not ideal to need a 6-hour round trip. And she actually, before she gave birth, had to consider getting an apartment closer to the hospital because you can't have that window of time before having a baby. So I know there's definitely a need for better education of OBs in the field around how to treat and work with women with OI who are pregnant. So this fact sheet is general to disabilities, but it included consideration of OI. And then our second piece of fact sheet that is titled, So You Want to Have a Baby, and it's for women with disabilities. And this looks at some of the things that you should consider as a woman with a disability if you're considering pregnancy. And disability identity sometimes or often kind of blurs into this because it doesn't only affect genetically whether or not our child has OI if we have OI ourselves, but it will also impact physically how we parent. And so sometimes it might bring us back to that interdependent piece that I brought up in terms of there may be parts of parenthood that you will need support around and how you're going to get that. And so I think that it kind of circles us back around to the talking about OI and thinking about OI is much more than a symptom list. It also involves what it means to us as a piece of who we are, not all of who we are, and what it means to how we relate to the world and society. And so it all ties together.
That's great. Thank you so much. And thank you so much for joining us today, Dr. Ayers.
Thank you for having me.
Listeners, if you have any questions or comments, please contact the OI Foundation at phonelink@oif.org. You can find all recorded OIF podcast episodes at www.oif.org/OIF podcast. Thank you for listening and stay tuned for the next episode.